So here you can see the areolar tissue. Areolar tissue is composed of fibers. The fibers in areolar tissue are collagen, elastin, and reticular fibers, and the cells are fibroblasts, macrophages, and mast cells and adipocytes, and embedded in a semi-fluid ground substance. So the functions are structural and metabolic support. So areolar tissue is found in superficial fascia deep to the skin, mucous membranes, and tissue surrounding the internal organs, that is called adventitia. So it's actually composed of all the types of typical found cells, like all the three types of fibers and all the four types of resident cells: fibroblasts, macrophages, mast cells, and adipocytes. But you don't find myofibrils here. And three types of fibers: collagen, elastin, and reticular. So it gives out the structural and support metabolic supports in the superficial fascia, mucous membranes, and tissue surrounding the internal organs. This is the areolar tissue structure. You can find this. These are elastin fibers, reticular fibers, and collagen fibers, and this several types of cells here. Okay, so then adipose tissue, a tissue packed with adipocytes. Connective tissue septa divides the tissue into lobules. It's a tissue packed with adipocytes. There are no spaces at all, and connective tissue septas are there. They divide the tissue into lobules. So you can see nucleus of the adipocyte, rim of cytoplasm, this fat droplet, and a capillary here, and then cell membrane here. So this provides body shape, contour, protection of internal organs, and cushions shocks. So the cushion shocks are cushioned by this adipose tissue, provides body shape. Body shape is provided, protection of internal organs, and by cushioning shocks, and storing fat, prevent heat loss as they store fat and burn them. So no, not burn them, but by just having fatty layers help you to preserve heat, right? So then they are found in subcutaneous tissues around the internal organs and breast tissue, non-lactating breast tissue, and around the internal organs and subcutaneous tissue. So you can see this is the histological view of adipose tissue. So this is you can see there are these flat these adipose cells. They are divided into lobules by septa. There are capillaries in between these cells, less intercellular space. Their tissue is packed with adipose, right? Now this is yeah, the adipose tissues, okay. And then also the nucleus and the periphery, like, and the cytoplasm, rim of cytoplasm, and a nucleus on the periphery, rim of cytoplasm and the nucleus found in the periphery, right? So this is adipose tissue. So there are two types of adipose tissue: white adipose tissue and brown adipose tissue. White adipose tissue, adipocytes with one large lipid droplet, low density of mitochondria. It's usually found in adults. Brown adipose tissue, it's found in many small. It has many small lipid droplets. You can see these lipid droplets, right? And then it also have high density of mitochondria, found in newborns, less in adults, seen around the adrenal gland, mediastinum, and para-aortic area. Where are they found? They are found in they are found in uh, they are found in adrenal gland, mediastinum, and para-aortic area, involves in heat production or thermogenesis in newborns. So they are found in adrenal gland, mediastinum, and para-aortic area. These have high density of mitochondria involved in thermogenesis of heat production in newborns, less in adults. So that is brown adipose tissue. So adipose tissue and obesity, rate of deposition and utilization of fat within adipose tissue is determined by the dietary intake and energy expenditure. So the dietary intake and energy expenditure decides the utilization of fat within adipose tissue, and influenced by a number of hormones like insulin, cortisol, growth hormones. So if there are defects in the hormone production of yours in cortisol, either growth or cortisol or insulin hormones, that can affect obesity. And also several genetic factors also affect obesity. Adipocytes modulate energy metabolism and influence general metabolism through secretion of several protein messengers, adipocytokines, that contribute to regulation of appetite and body mass. So as you can see, adipocytes modulate energy metabolism and adipocytes modulate energy metabolism and influence general metabolism through secretion of several protein messengers. So rate of deposition of utilization of fat in adipose tissue is determined. Okay, so the adipocytes modulate energy metabolism and influence general metabolism through secretion of several protein messengers. They are called adipocytokines that regulate to the appetite and body mass. So appetite and body mass is actually decided by these adipocytokines, which are protein messengers that influence the general metabolism of these adipocytes. And then obesity epidemic linked to rising prevalence of metabolic syndrome equals abdominal obesity plus hyperlipidemia plus hypertension plus insulin resistance. So this is actually something we have to have overall knowledge of. Major contribution to development of vascular disease like stroke, myocardial infarction, and peripheral artery disease. So this is insulin resistance, vasculature, skeletal muscle, liver, defective insulin signal, impaired glucose uptake, dyslipidemia, gluconeogenesis, and adipocyte hypertrophy, inflammation, macrophage infiltration. Several things you have to figure out. So okay, now let's move on with our lecture. This is called reticular tissue. So reticular tissue is the third type of connective tissue we are going to discuss. As we know, it's a loose type of connective tissue. A network of reticular fibers stains very poorly in H and E, stains black in metallic silver stain, and reticular cells, white blood cells, and lymphocytes. So lymphocytes and white blood cells are found here, and then it's a network of reticular fibers. It's called reticular tissue. It's easy to remember, right? As you can see, reticular cells, blood cells, and lymphocytes also found within here. White blood cells and lymphocytes and the reticular fibers are also found. Its function is providing supporting framework in solid organs and tissues, providing supporting framework in solid organs and tissues, and it's found in kidney, liver, spleen, lymph nodes, and bone marrow. Bone marrow, lymph nodes, kidney, liver, spleen, like all the important solid organs and tissues are given this supporting framework by reticular tissues, which is composed of reticular tissues, reticular fibers, reticular cells, that is white blood cells and lymphocytes. Um, yeah, it is a very poor stain in H and E, and stains black in silver impregation method. So you can see it has been stained black in the silver impregation method. So you can see the reticular fibers, right? And the lymphocytes and white blood cells. So the fourth one, dense regular connective tissue. Dense regular connective tissue is a type of dense tissues. It's collagen fibers arranged in closely packed bundles, fibroblasts in rows between bundles of collagen. So you can see the collagen fibers arranged in closely packed bundles. So closely packed bundles, these collagen fibers are arranged in closely packed bundles, and in between them, in rows between them, there are bundles of fibroblast. Fibroblast is the cells that secrete collagen, right? And yeah, so they are found in ligaments and tendons and aponeurosis and ligaments. So the function of it provides strong attachments between structures, provide strong attachments between structures, and also conducts pull. So you can see in the dense regular connective tissue we can find this what's this this is the histological diagram. So this dense regular connective tissue of a tendon, you can find this dense or closely packed collagen fibers, and between them you find the fibroblast. And then the dense irregular connective tissue, it's randomly arranged bundles of collagen fibers and scattered fibroblasts. So unlike the dense irregular connective tissue, it has bundles of collagen fibers, but they are randomly arranged, and also the fibroblasts are also scattered. So this you can see the collagen fibers are arranged randomly, and then fibroblasts are scattered, and capillaries are found here. So they are found in joint capsules of organs. First, dense irregular connective tissue are found in tendons and ligaments and aponeurosis, but these dense irregular connective tissues are found in joint capsules and capsules of organs and pericardium of heart, sheaths around muscles and nerves. So it's found in joint capsules. So it's found in joint capsules of organs, pericardium of heart, sheaths around muscles and nerves, provide strength to resist force applied from different directions. So the importance of these dense irregular tissue is they provide strength to resist force applied from different directions. So in joint capsules and capsules of organs, and even in the pericardium of heart, and all the sheaths around the muscles and nerves, they They are subjected to different strengths or forces that are applied from different directions. So these to resist these forces, strength is provided by dense irregular tissues in joint capsules, capsules of organs, pericardium of heart and sheaths on muscles and nerves. Okay, let's move to the next type of yeah. Then this is the histological diagram. You can see this randomly arranged collagen, and there are several fibroblasts between them. They are also scattered everywhere. This is found in dermis of the skin. So actually, the skin is given forces from different directions, and we have to provide strength against to resist them. So in the dermis of the skin, this is the dermis, and this is the epidermis, right? So this is the keratinized layers of skin. This is the epidermis, and this is the dermis. So the dermis is composed of this what dense irregular connective tissue. It's a very important fact you should remember. Not only not only joint capsules, but also in dermis of skin, we can find this dense irregular connective tissue. So finally, we reach the elastic tissue. That's a final type of dense type of connective tissue. It's a wave-like thin fibers, and it has scattered fibroblasts. So it got elastic fibers, wave-like thin fibers, and you've got a scattered fibroblasts. So you can see the histological diagram. It's got wavy like elastic fibers and scattered fibroblasts. So it's like the typical stuff, very special histological diagram of it. So elastic tissue in the wall of aorta. In the aorta, you find this elastic tissue. It provides, I think, it allows stretching and recoiling. So because of that, as it allows stretching and recoiling, wave like thin fibers, right? Allows stretching and recoiling. It's found in aorta, wall of aorta and large arteries, bronchial and lung tissues, bronchial and lung tissues, some ligaments of vertebral column. Some ligament of vertebral columns, like those ones that allow stretching and recoiling, and wall of aorta and large arteries, bronchial and lung tissues also composed of stretching this elastic tissues, because they are bronchials also they have to expand, right, when air is getting filled. So because of that, it's also made of elastic tissue. Now we are going to discuss about tissue repair. So tissue repair, how does it happen is clotting occurs caused by clotting proteins and plasma proteins, and a scab is formed. So whenever there's an injury, what happens first is homeostasis and inflammation. So what happens here is that inflammatory chemicals are released from injury. So there's an injury, then inflammatory chemicals are released. Then white blood cells seep into the injured area. So when there's an injury, it releases inflammatory chemicals, and then white blood cells seep into the injured area. So then clotting occurs. Clotting happens by this clotting mechanism by white blood cells. Clotting occurs caused by clotting proteins and plasma proteins, and a scab is formed. So this step is called homeostasis and inflammation. The second step is called granulation tissue formation. So what happens is epithelial cells multiply and fill in over the granulation tissue. Fibroblasts lay down the extracellular material and form granulation tissue. So granulation tissue is formed by fibroblasts as they lay down the extracellular material, and then epithelial cells multiply and fill in over the granulation tissue. Then the third one, scar tissue formation, underlying area of scar tissue, restored epithelium thickens, the area matures and contracts, then underlying, this is the underlying area of the scar tissue. So there are several connective tissue disorders, abnormalities of the amount or structure of the different components of connective tissues. Okay, so the clinical correlates for the connective tissue disorders, abnormalities of the amount or structure of the different components of connective tissues. Abnormalities of the amount or structure of the different components of the connective tissues can be a disorder, right? There are abnormalities in the amount or structure of different components of connective tissues. So they commonly affect skin and mucous membranes, joints and blood vessels, can also involve internal organs. Two main types, inherited disease and autoimmune disease. Okay, so they affect neurological cause neurological complications, skin and mucosal complications, lung complications, renal complications, gastrointestinal complications, blood-related complications, complications in joints and bones. So because connective tissues are literally everywhere, it's in skin, lung, renal. So complications affecting the hearts and blood vessels. So inherited connective tissue disorders commonly due to abnormal structure or reduced production of collagen or elastin fibers due to genetic mutation. So, because of a genetic mutation, um, there's lack of production of collagen or elastic fibers. So this syndrome is called Marfan syndrome. So you can see this Marfan syndrome person. He has an abnormal chest, heart lung problems, short torso, curved spine. It has a short torso and a curved spine, tall thin body frame, long arms, fingers and legs. Arm span is greater than height. So, arm span is greater than height. It has long arms, long fingers and legs, long legs, tall, thin body frame, short torso, curved spine, eye problems. So, Marfan syndrome caused by abnormal fibrillin protein essential for the formation of elastic fibers due to fibrillin FBN1 due to fibrillin gene mutation due to fibrillin FBN1 fusion caused by abnormal fibrillin protein essential for the formation of elastic fibers due to fibrillin FBN1 gene. So there's mutation in this gene called fibrillin 1. Because of that, there's an abnormality in formation of fibrillin protein. Fibrillin protein is essential in forming elastic fibers. So because of that, Marfan syndrome is caused where this um, production of fibers is not enough. So there equals short torso and curved spine, tall thin body frame with long arm, long fingers and long legs, and then abnormal chest and heart problems, and there are eye problems also. So next we find these autoimmune connective tissue disorders due to abnormal immune systems against body's own healthy tissues. Rheumatoid arthritis. So rheumatoid arthritis is quite famous. It's a systematic disorder in which immune cells attack and inflame the synovial membranes of the joints. So we know the joints have several type of connective tissue. We know the joints of capsules. So they are composed of, I think, dense irregular connective tissue, right? Yeah, dense irregular connective tissues. So the rheumatic arthritis mean that the body's own healthy tissue is attached by the body's own immune system. So systemic disorder in which immune cells attack and inflame the synovial membranes of the joints also commonly affect the heart, lungs, and eyes and skin. Genetic susceptibility and environmental changes, loss of immune tolerance at mucosal sites, antibody production, pain, bone loss, osteoclast activation, IL-12 production. Second hit, minor joint challenges, pain, inflammation, and erosions are caused by this. That's it. Thank you for joining. Let's meet in the tutorial session about connective tissues. About the blood, bone, and cartilage, we will be discussing in the next video. Please put a comment below and subscribe to my channel.